This is Kevin O'Connor with Dr. Christian Mancao. Dr. Mancao is an MD, trauma surgeon, and a pain removal specialist. Dr. Mancao, I've had the opportunity to watch you literally remove pain in a few moments, but I've also watched you talk to crowds over the last 2 weeks about the importance of having a mineral product that is very high energy. And this particular one has something called marine phytoplankton in it, which is a plant food. Now, one of the things that's important about this is we can show people how, most water and many of our foods in our diet are acidic, so we need to increase the balance of pH in people's bodies. Why do we need to do that?
Because our blood plasma pH is slightly alkaline, and it is maintained at a very narrow pH from 7.3 to 7.45. The food we eat are very, very acidic. Now, most of the cola drinks, or some cola drinks, the pH is 2.5. It's the same as commercial grade muriatic acid, so it might not be very good for the health on the long run. Now, bottled waters are also a problem because most of the bottled waters that are distilled water are very, very acidic and devoid of minerals.
So this is distilled water,
Yep.
and though it's clean, it is dead water, is one way that I've heard it put.
Yeah. But more important is it's very, very acidic. Now, this is a pH testing solution with a color scale. Now, once we put a few drops inside it, you will notice that the color of the water becomes yellowish, and yellow is pH 5. Now, the product we're talking about is a alkaline mineral, and just 2 or 3 drops as you take it, you will notice something strange. It starts to become bluish in color, becomes more alkaline, but as the minutes pass by, it becomes darker and darker and darker, which is very good for the body because it is not caustic. It slowly develops its alkalinity so that it can easily neutralize the very acidic content of the body.
So I hear the term acidosis all the time, and in the U.S. people are constantly dropping things like Tums and Rolaids in because they've got this acid taking place in their body.
Yeah.
And that, should they be doing that?
Well, there has been a major change in the approach of the idea or the disease called peptic ulcer disease or peptic ulcer syndrome. Many years ago, more than 30 years ago, ulcer was caused by acid. But in the late 1980s, 1986 to be more precise, I believe, 2 Australian doctors started taking the bacteria called Helicobacter pylori, and they developed ulcers, and which changed the whole paradigm of treating people with supposedly hyperacidosis or gastritis. Milk is a very big problem because if you give it more to patients suffering from peptic ulcer disease or gastritis, it becomes more severe. So the best is to alkalinize or alkalize the patient. Look, it's becoming deeper and deeper in color already.
So we're starting to move into that purple range, which is around a 10.
Yes.
And so if I understand correctly, if I'm taking in a lot of acidic foods, my body wants to be in stasis. It wants to be at about 7.3, 7.5.
Yeah.
So by having a product that can bring us up higher than that, I'm helping to reduce the effect of the highly acidic diet. Is that right?
You optimize the function of the cells because they are now functioning at the basic pH by which they can optimally deliver what they're supposed to do. Now, it's even medicines that are very acidic, mefenamic acid, acetylsalicylic acid, and that disturbs the body pH.
That's pretty amazing. We went from yellow a couple seconds ago, 5 pH, to now we can see right in front of our eyes the difference. Dr. Mancao, that's great. So we're pH. There are 92 minerals in the product, marine phytoplankton. Probably a lot of the patients that you see are mineral deficient. And therefore, as a result of that deficiency, there are certain breakdowns in the body that are taking place.
Most of them are acidotic actually. When you look at their face, They have this crumpled paper look.
Mm-hmm.
And just by looking at them, we know already their degree of acidosis. You don't need to do any test. But the only way you can neutralize the acidosis is to give more alkali. And the most appropriate alkali that I have stumbled across in my practice would be a product like this that is very safe, highly mineralized, energized, and can change the outlook of the patient in just seconds sometimes, especially if you do energy testing.
Well, it's very exciting to be able to contribute to the health of people with that kind of mineral content, the energy, and the idea that simultaneously we can help them become more alkalized. What a phenomenal thing. So, Dr. Mancao, I really appreciate your sharing your knowledge and experience with us here. Kevin O'Connor signing off, and don't forget, a couple drops a day might in fact help keep the doctor away. Thank you.
Yep.